Hi, my name is Ashanti Jordan. I'm a student of physical therapy. I'm going to be working with you today. So, for this part of the exam, I'm just going to be asking you a couple questions to get a sense of what's going on and what brought you here to physical therapy. So, this part will only take about 10 to 15 minutes.
Okay.
And during the process, I'm going to be writing things down just to make note and keep track of what you're telling me so I can use it later on to make a treatment for you.
Yeah, that's fine.
Do you have any questions?
No, none new right now.
Okay. So, just to verify, can you tell me your name
Jimmy Budweiser.
and your age and date of birth?
I'm 38 right now, and my birthday is November 29, 1980.
So, what brings you here today?
So, 2 weeks ago, I was out on my ranch and I was herding my goats, feeding them and stuff, and then one of them happened to headbutt me in the knee. So, yeah, ever since then, I've been having a lot of knee pain.
So, is that what you do for a living? You're a goat herder, or
No, that's just something I do on the side, but I'm actually a backhoe driver. Um, yeah, I just kind of recently actually I got a contract to work on some hiking trails
okay?
for local parks and stuff. So really excited to do that, but I haven't been able to do that since the knee pain kicked in.
So, with your job, what are the physical requirements? Just driving the backhoe, or
For the most part, I'm just sitting in there all day, just working on stuff. So not a lot of movement, but I haven't been able to do that partially because getting on and off is really hard for me.
so when you're at your job, when you're
Mm-hmm.
walking around, would you say it's more like grassy surfaces, concrete, dirt, like uneven, rocky surfaces?
It really depends. Sometimes it is even grass, sometimes it is rocks and a lot of steps and stuff. So it just kind of varies.
Okay. So while you were talking, I filled out your body chart to
Okay.
see where your pain was. Can you just verify that this is correct for me?
Yeah, it looks good. It's right there on the knee.
Okay. And just to double check, you don't have any pain in your hip,
Nope.
any pain in your lower back,
Mm-hmm.
in your calf,
No.
ankle, nothing in your foot either?
Nope.
Okay. So with your leg pain, how would you describe it?
It's kind of like a dull aching feeling. Like it's just kind of irritating. It's just always in there. But yeah, it's just a dull ache.
So I'm gonna have you rank your pain for me
Okay.
on a scale of 0 to 10. 0 being no pain, 10 being the worst pain you ever felt.
Okay.
How would you rate it at its current, like right now?
Probably a 2 out of 10.
10.
Yeah.
At its best
0. Sometimes I just don't have any pain, so
and at its worst.
probably a 4.
So when you notice your pain is at its worst, what are you usually doing?
Um, for the most part, walking upstairs or stepping on or off the backhoe. Yeah.
So with the stairs at your house, do you have any stairs that you have to go up or go down?
Yeah, I actually live in a trailer and there's 5 set of stairs or 5 steps that I had to walk up, but there's a handrail, so I've been able to kind of cheat my way up, but it's been pretty hard, especially going down.
Especially going down.
Yeah.
So to ease your knee pain, what do you usually do?
Um, well, I tried to look into it a little bit. I heard something about rice, so I've been kind of just laying in bed, relaxing it, propping my leg up, and it tends to feel better.
So are you taking any medications to help ease your pain?
Not right now, but right when the injury happened, I was taking some Advil just to kind of ease the pain, but I stopped taking it because I noticed the swelling went away in my knee.
Okay. So how does your knee pain feel in the morning?
When I wake up, it's really stiff, so I have to kind of stay laying in bed and kind of move it around until it's kind of ready to go.
How long would you think it takes for it to unstiffen?
Probably just like 5-10 minutes. I just kind of lay in bed a little bit longer and wiggle my legs around just to get it moving.
And how would you rate the morning pain on the 0 to 10 scale again?
Um, Probably like a 3 when I'm trying to like move around and kind of get it up and moving.
How would you say it feels throughout the day?
It depends on what I'm doing. If I'm resting, it kind of goes away. But if I'm doing stuff like walking around the house or like going out and about, then walking makes it worse. Going up and down the stairs of my trailer make it worse.
And at night, how does it feel?
It's not too bad. I normally just sit around or I'm laying in bed, so pain kind of goes away. So it's anywhere from like that, probably 1 0 to 1 range.
So does the pain wake you up any at night?
Mm-mm.
So you're sleeping throughout the night just fine then?
Yes.
Okay, that's good. Okay. So now it's time to kind of get a little information about your history.
Okay.
So does anyone in your family have any serious health conditions like diabetes, any type of cancers or anything?
No.
And do you have any of those?
No, I don't.
Have you ever had a serious injury or anything before?
Yeah, back in high school when I was playing football, I actually broke my collarbone, but everything went smoothly, so it doesn't give me any problems anymore.
Do you know what type of surgery you had for that, or?
No, we didn't really do surgery. It was just more like just bracing it and taking some medicine and some exercises here and there, but it generally healed pretty good.
Okay. So I know you mentioned you did exercises and stuff for your
Yeah.
clavicle. So have you been to physical therapy before?
I haven't, but I kind of figured exercise and getting it moving would be good for it, so that's why I kind of feel about this too. I've been trying to move it more, but I'm not sure what exactly I need to be doing to get it to feel better. So
Well, I think it's good that you came in because we'll both work together to get you back mobile and back to work. So, when you first got your knee injury, did you go anywhere and get any X-rays, MRIs, or anything done?
yeah, immediately after I went to the ER because I was worried something might be wrong, and I got an X-ray done, but it came back negative. So
So have you been to any doctors for this knee pain?
ever since the ER, really went back to the doctors for it all.
So, have you ever hurt your knee before?
Nope, this is the first time.
So here at Physical Therapy, to better make an exercise plan for you, we have the patients make their own set of goals to reach so we can make sure that the treatment's going in the right direction. So what goals do you have for yourself?
Probably the main thing is just to get back to work. Probably be able to walk up and down stairs without pain, walk around without pain.
Okay. So whenever we start making the exercise plan for you, how would you like it to be presented to you? We can do like demonstrations, I can give you a handout, show you a video. Which way do you think will work best for you?
Probably the best way is to demonstration, and maybe if I could like practice it myself and you see if I'm doing it right or wrong.
Okay.
So
All right. Well, that's this part of the interview. Next, we're getting to the objective, where I'll take some measurements, get you moving a little bit to see what's going on exactly.
sounds
Do
good.
you have any other questions or anything?
No, ready to go.
Okay. Thank you.